differences between how issues impact men and women. When you look at women, we're not a homogeneous group, and women of color are often even more dramatically impacted by some of these disparities. And I'm just wondering how you address that in your overall plan.
That's right. And one example is that gender pay gap. So when we mark Equal Pay Day, it actually comes on a different date for white women, black women, and Latina women. And we have to face the fact that this too is the result of structural factors that were put in intentionally. They're not going to be removed without intention too. In other words, if you have years of a racist policy or structure, and then you swap it out for a neutral policy, that's not going to be enough to get you to equality, because in the same way that when you save $1 over time it compounds, well, the theft of generational wealth, the effects of that compound too. So you take an example like healthcare. The example that we've heard about the most is that a black patient who goes in when there's a complication around childbirth or that maternal mortality gap, 3 times as likely to lead to a fatality than for a white patient. That is largely the result of different levels of patients being believed when they describe being in pain. And so we've got to face the fact that cultural competency and racial awareness is critically important to health. That's just one example. And the reality is, it's not only things that happen in the clinical environment, it's also environmental factors. So before you ever cross the threshold of a hospital or a doctor's office, people of color are more likely, for example, to live in neighborhoods where safety concerns make them less likely to walk regularly, which makes them more vulnerable to diabetes, or are more likely to live in areas where there's been a history of environmental contamination, which means they're more likely to experience cancer. All of these things are connected. So what I'm proposing that we do is develop what are called health equity zones and fund them with federal dollars, recognizing that the issues really are different in different communities, and some of the solutions are too. So in South Bend, for example, there was an initiative, this is on the men's health side, but another example of a racial disparity, where it turned out that African American men were less likely to get tested for diabetes. They were less likely to feel that they were welcome to go into a doctor for that kind of preventive care. So nurses started showing up in barbershops where there was a level of comfort and a level of familiarity to talk about the issue and do testing on the spot. Just one example of a local initiative. But when you put together a package of local initiatives, clinical interventions, and community-oriented solutions, then you can begin to map out the road to equity that's appropriate in a given area. And I'm proposing that we take federal dollars to fund local health equity zones. So that's part of our Douglas plan, which is about tackling systemic racism across all the dimensions of American society. And just like our plan on women that we're rolling out today, I believe it's the most comprehensive, because I don't think you can get to these things without attacking all of the different pieces. Another thing that's crucially important is criminal justice. So the closest thing we have to a national system for re-entry after incarceration is called women. Women who pick up the economic burden when a loved one is incarcerated, and who are really the nearest thing we have to a healthy network of services for reentry, but it's all informal, it's expensive, it's a huge burden, and they're not supported. One of many, many reasons why we need to cut incarceration in this country by half, and I have a plan to do that. Last thing I'll mention is on the solution side, again, entrepreneurship and supporting access to credit and the ability to build businesses. No one has a better track record of empowering women of color than women of color. So when they're in charge of a business, we should support that, because it's going to extend opportunity.
Well, thank you.